Hi, my name is Shonkwiler, and I'm an oncology nurse practitioner. A port or a portacath, as it may often be called, is a very common recommendation by your cancer treatment team as a way to deliver intravenous or IV cancer treatments. It's also extremely helpful because it is also a way for you to draw blood. The port itself is actually, this is just an example of one kind of port. It's actually a small implantable device, and it's usually placed underneath your collarbone. Generally made up of metal, or this one's plastic. The size of it can be a nickel, even up to the size of a quarter. It is actually, this one is triangular, but it can be circular, oval, just depending on the brand that's chosen by your cancer treatment team. It is actually something that sits underneath the collarbone. And then as you see, it's got a flexible tube that's attached to that. And this is actually what's thread through a large vein in your chest. So reasons why your cancer treatment team may suggest that you get a port is because your treatments may require that you have the treatment go on for a few days. Or it's also very common if you have struggles with getting IVs placed or have a difficult time getting blood drawn, as a very easy and convenient way for that to be done. The port can also be used for x-rays such as CTs or MRIs, and that's a very nice way for you to receive the contrast and not to have a separate IV. Um, the port, once it's placed, actually can be used for months or even up to years. And the cancer treatment team that you're with will help you decide how long you need to keep that. Most patients, once they get their port, they love it. It's a wonderful and convenient way for them to get their IV cancer treatments, to get blood drawn frequently. And it's just a very, very helpful thing. Many patients will tell me they don't want to lose their port anytime soon because it's so helpful. I do want to talk just briefly about how it's placed. It is placed generally as an outpatient procedure, generally by either a surgeon or by an interventional radiologist. When the procedure is done, you'll have an IV placed. They'll give you some medicine to help you feel more comfortable, relaxed, decrease pain. They'll also give you a little bit of local numbing medicine in the area while they place the actual port. There's two incisions that are generally made. One's going to be done just below the collarbone, and that's actually where the port is going to sit. And then on the same side, up by the neck, is going to be just a very small incision. And that's actually how the surgeon or interventional radiologist uses to actually thread that tube into that large vein near your chest. It is going to be tender and sore for a few days. And so you can use over-the-counter medications such as Tylenol or ibuprofen if necessary to decrease your comfort. The team that puts in your port is also going to give you very specific instructions. You're usually going to go home and have a bandage over it. They're going to let you know when you can take that bandage off, when you can start to shower. So just be sure to follow those directions. It will be a little bit swollen also for a few days, but eventually that swelling will decrease, and then you'll mainly just notice the bump underneath your skin. So now that you have the port placed, then it can start to be used. So generally in your cancer clinic, a specially trained registered nurse will be the one to use your port. Often the term that we'll use is that we're going to access your port. And basically what they'll do is they will need to get to the area of the port. So a pro tip would definitely be to make sure that you're wearing a shirt where you can allow easy access to the port. They're going to clean that area very well, and then they're going to use a very special needle to push through the skin into the port itself. Now, it's very common that your cancer treatment team may prescribe a numbing cream for you to put on. That actually is best placed at home, and you just put a little bit of cream over the area of the port and cover it with a little bit of plastic. And then when you come into the clinic, it's ready to be used. It takes about 30 to 60 minutes for that skin to fully numb. So then the nurse will actually push the needle through the skin into the port. Generally, if you have the numbing cream, you're just going to feel a pressure sensation, and then they're going to cover it with a clear dressing. At that point, it's ready to be used. So the nurse can draw blood through it and give any medications that are needed, obviously including your cancer treatment medications. Now, once this is accessed, if your treatment just takes a few hours, then that's all the time that you'll need to have the needle in your port. Some cancer treatments actually will require that you keep the port and go home with a chemo pump for a few days. Obviously, that's specific to the treatment for your cancer. Once it's not needed to be used anymore, whether that's a few hours or a few days later, the registered nurse will actually flush your port. That's what we say when we're just pushing in some salt water or some heparin, which is a blood thinner, just to help make sure that the port is staying nice and open and ready for its next use whenever that may be. Then they'll actually take the needle out and just put a little Band-Aid over it that just needs to stay for an hour or two. The really wonderful thing once your port is placed and it's healed is you can do most activities just normally. You can take a bath, you can take a shower, you can swim, all that can be done with the port since it generally just sits underneath your skin. The other thing is that if your port is not being used on a regular basis, we do still need to flush and clean out the port about once a month. So that may be scheduled in your cancer clinic. Again, once cancer treatments are done or your treatment team decides you don't need your port any longer, the port can actually be removed again. And again, usually either by the surgeon or the interventional radiologist that placed it the first time. Now, having a port, while it's wonderful and convenient, does have a small risk of some issues. Thankfully, these aren't very common, but there are things that we're going to look out for. There's always a risk for infection since you have something placed into your body. There's a low risk for there being a blood clot. Sometimes the port itself can twist. Sometimes it can get clogged up a little bit, and the nurse actually can use some medicine to clean that out. But obviously, if you notice any issues with your port, please make sure and let your cancer team know just as soon as possible.